Hello, this is Dr. Joseph Fair with NBC Medical, and I'm here to answer your questions today, if I can, on COVID 19 and the coronavirus epidemic or pandemic. I am a virologist and an epidemiologist by training. I'm not a medical doctor, and so I can answer anything you have kind of scientifically about the virus itself, or if you have any questions about the pandemic or the epidemic itself, I'm happy to answer any of those questions for you. So whenever you'd like to get started, I'm happy to start taking questions from anyone that might be able to join us today. I think some people are just joining us. I'll just say it again. My name is Joseph Fair, and I am a virologist and epidemiologist, and I'm specialized in emerging viruses. I've spent the last 20 years of my life and career in Africa and Asia studying emerging viruses and how they emerge from animals into humans, as well as vaccines and diagnostics. Let's see. I'm going to answer your questions as they come up. Good morning. Thank you, Ryan. Does lisinopril increase the chances of severe lung involvement? I'm sorry, I don't know the answer to that. I apologize. I'm not a medical doctor. Is this virus natural? It is a natural cousin of the SARS virus. It's very closely related to SARS. It's more contagious but less deadly than SARS virus. That's why it's called SARS-CoV-2. Will this be in October or what? Over in October or what? Not likely, no. We'll probably likely have COVID-19 with us until next year sometime. I'm not sure when, but we're going to have COVID-19 with us for quite some time. Until at least we have a vaccine or a herd immunity to it, whichever comes first. Is it safe to go out and shop for groceries? You have to go out and shop for groceries. It's a necessity of life. And so I myself go out and shop for groceries. The most important things to remember when you're shopping for groceries are keeping as maximum a social distance as you can from everyone else. That you're really being sure not to touch your face. It is a good idea, following the current and most updated guidelines, to wear a facial covering. And that's really to protect others in case you're transmitting the virus yourself. It'll give you some very limited protection yourself, but it's mostly for others. But the most important thing is to wash your hands before you touch your face, and then making sure you kind of wipe down everything that you got at the grocery store when you get home and before you put it into your fridge. When can we expect this to end? I would say it depends on what you mean to end. The social distancing is going to continue for quite some time. That will probably continue, I would say, late until the year at least, maybe into next year. I think the mayor of Los Angeles said that he couldn't expect having any large social gathering events before 2021. And I can see where that would be the case, that we might, not be able to before that time. We're definitely not going to have a vaccine before that time. So unless we develop some kind of herd immunity before that time, that might be the case that we're going into 2021 with social distancing measures in place. That doesn't mean all of the businesses and all of the restaurants and everything is going to be closed until then. Obviously, we're going to have find some way to open them to at least some extent to where they can maintain some kind of business. But it's going to be a tough go for the next, anywhere from 6 to 12 months, if not longer. It's been over 30 days, and just a few days ago I started getting my taste back, but no smell. Is this normal? It's probably not normal. I mean, I'm not a physician, so I'm a scientist, but one thing I will tell you is that a defining characteristic of this infection is the loss of taste and or smell, and you can have that in the absence of other symptoms. And so that kind of it tends to be a defining factor of COVID-19. I just had another friend that was in a similar case that I told him the same thing, that I thought it was COVID-19. He had lost his taste and smell, but nothing else. What is my concern with the White House defunding the WHO? I think you mean to say. There's a lot of concern with that right now because the WHO is the one that's managing the COVID-19 response globally, and I know there's a lot of criticism for the WHO. I have personally worked at WHO for quite a long time in my career, and I have to tell you, their work is incredibly hard to do, and there's so much of it, and it's nonstop, and it's incredibly dedicated individuals all over the world that work for them. That being said, they're open to some criticism, but I think it was a large mistake for us to defund them, and we're their largest donor, other than ourselves, China, Russia. A few others are their largest donors, but we are definitely their largest donor. And I think pulling away all of a sudden during the largest outbreak in modern history is a big mistake for the United States to make. What is my take on melatonin in reference to the virus symptoms? I'm sorry, I actually don't have any knowledge with regards to melatonin and the virus symptoms. I apologize. Why don't you tell people that COVID-19 is fake? Because it's not fake. I apologize. I can't say it is if it's not. Can the virus resurface like shingles virus? That's a really hot topic and question right now is, can you get infected again? Not resurface, but can you get reinfected? Right now, the reason we're saying that is there's around 91 cases from Korea where people tested negative for the virus. They were released, and then they later tested positive for the virus again. So that either means that they had a false negative test and were released before they were actually negative, or they actually were reinfected again. So there's 91 of them. That's no small amount of people. That being said, there can be a lot that goes wrong in the testing process, how you collect the sample, how you store the sample, if there's contamination of the sample. So my thought is probably that they were false negatives and that you cannot be reinfected. That's just my thought as of now. I may eat my words on that, and I may be wrong on that, but in the laboratory studies of COVID-19, monkeys could not be reinfected with the virus. And so I think once you have it, you're immune to it. And I think when you're saying resurface like shingles virus, it's not a virus that your body holds on to and that is persistent in your body after that. Once you clear it, you clear it. Can I speak of the second wave? The second wave that we're talking about traditionally means that we'll have a first wave in the spring of like colds and flus and respiratory illnesses, and then we'll have a second wave in the fall. Right now, we're not seeing a huge slowdown. We're seeing some slowdown, but not a huge slowdown of the number of cases. But we're hoping that we will see a significant slowdown of the number of cases in the summer months. That's typically due to the number of daylight hours and the sunlight. UV light inactivates the virus, and we tend to spend a lot more time outdoors in the summertime, so there's just frankly less transmission, and there's more natural disinfectant from the sunlight coming down that inactivates the virus. And so when we talk about the second wave, we're talking about it decreasing in the summer kind of naturally due to those natural conditions, and then coming back in a larger wave or a second wave in the fall. It could be larger, could be smaller. With the 1918 flu, the second wave was actually the most deadly and the largest wave of the 1918 influenza, even though this is not influenza, but just to let you know that second waves aren't always smaller. Herd immunity, please explain further. So herd immunity is when a group of individuals, say the population of the United States, gets infected with a virus, and the majority of us recover. Say, anywhere from 60 to 80% of us recover from the virus. Every year we have a herd immunity to influenza because every year our species around the world is exposed to influenza. So we have some herd immunity to seasonal influenza, even though we all still get influenza. Not everybody, but most people still get influenza. So we have some herd immunity to that. we have no herd immunity whatsoever to this coronavirus. We have herd immunity to other coronaviruses, the ones that cause the seasonal cold. We have herd immunity to those viruses because we've been exposed to them before previously as a species. This COVID-19 or SARS-CoV-2 we've never been exposed to, so we have no herd immunity to it. We can develop herd immunity to it over time, and because the majority of people do recover from it, presumably we would develop herd immunity to it over a significant period of time, but there would obviously be a lot of people that would have to die for us to do that. Is there any truth to the different strains causing different regional mortality rates? To be honest, we don't know the answer to that right now. That could be the answer. Often in virology, there is a mixture of the viral genetics compared with the host genetics. There's also the difference, in the regionals, when you look at things regionally, in our lifestyles. The United States leads the world in the high-risk lifestyles, so the high-risk categories, rather, diabetes, heart disease, not necessarily smoking, but vaping as well. All of those different categories put us at a higher degree of risk than, say, a healthier society, say, than Italy or Spain, where they tend to live a little bit healthier than we do. China had its own issues. Wuhan, in particular, had a lot of air pollution. And so they had a lot of lung-related issues related to air pollution. We do have a lot of asthma and things like that in this country as well. So all of those cause underlying issues which make COVID-19 worse. But to answer your question, there still needs to be science done on whether any of the different strains, they're not actually different strains, so I shouldn't call them that, the different subtypes of COVID-19 are causing different mortality rates. When I use bleach diluted with water to wash off groceries from the store, do I need to throw the rags out? Not necessarily. I mean, you can let them dry and use them later if you're using them with bleach again. They're just fine. Is the virus spread through the cans and plastic bags we touch from the grocery stores? Theoretically, it can be. It can theoretically live on surfaces, depending on what the surface is, the heat and humidity, and if it's in the sunlight is touching it or not. It can live anywhere from hours to up to 9 days on surfaces. So theoretically, it can live on those things. I know when I bring things like a soda can home or something like that, I'll tend to wipe the top of them off with a wet paper towel or something like that before putting them in the refrigerator. Plastic bags, there's a very low chance of getting it that way, but theoretically you can get it from plastic bags as well. So what I advise is when you bring things home, you have a certain area designated where you put the bags. I would typically put them on the floor rather than a countertop. And take your groceries out. If there's anything cardboard, either wipe it down or take whatever it is outside of the cardboard and throw the cardboard away, and then throw the bags away. If you're using a reusable bag, just wash the bag afterwards. Is it getting worse? I assume you mean the pandemic. Is it getting worse? Globally, it is still getting worse. I would say globally, we're starting to see it maybe plateau a little bit. With the number of cases, and I'd say that we're not going to see a huge change in numbers right now, because right now the southern hemisphere is going to be going into its cold and flu seasons, and we are going to be going into our summer months. So, we might see a dip in the numbers for the northern hemisphere and in the United States, for example, but we'll probably see a rise in the number of cases in the southern hemisphere, like Australia and Argentina and Chile, etc. So that's why we also expect, say, a second wave to come back in the fall. SARS vaccine seems to be working. Have you heard this? Yes. So there is a vaccine that was started for SARS. It was never finished because the funding dried up from out of Baylor College of Medicine in Houston. And that vaccine does appear to be cross-protective for COVID-19, at least in the very preliminary study. So that could be ready to go into humans, at least in a phase 1 clinical trial, which means it's going to go into healthy human beings first, not sick human beings, fairly soon. And so that's probably one of the closest vaccines there is to going into humans. So what do I think about remdesivir? Remdesivir is a drug by Gilead Pharmaceuticals, and what I think about it is it's undergone now a couple of clinical trials, one in China and one here in the United States, and it has performed well in both of those trials, and so I think it's a very promising drug in the fight against COVID-19, and so now that it has shown that efficacy in 2 trials. I would hope that they can get some kind of emergency use authorization or compassionate use authorization from the FDA to allow physicians to prescribe it for COVID-19 treatment or SARS-CoV-2 treatment. Is it safe to walk outside? Yes, it is safe to walk outside. Obviously keep your social distancing measures that we've talked about, keeping ideally around 6 feet away from someone else. We are recommending that if you're going to be around other human beings that you do, take a face mask with you and you're wearing a face covering, just because, again, we think that, pre-symptomatic or asymptomatic individuals are able to spread the virus, and that's why we've seen such an explosive spread of the virus, around the United States and elsewhere around the world. So we're asking people to wear that face covering to prevent them from spreading it in the case that they are pre-symptomatic or asymptomatic. Do I think the outbreak will get better with the warm weather? That's a little bit what I was talking about earlier. I don't know if you were online at that point, but in the summer we have more daylight hours, and the daylight hours contain UV light, and UV light inactivates viruses, and so we tend to see a dip in our cold and flu season because we're outside more, meaning we're not in as close and confined quarters where we can more easily transmit the virus to one another. And outside we have the added benefit of having sunlight there, and that being nature's disinfectant, inactivating the virus. And so we don't know if we're going to see yet a dip in COVID-19 with our own summer. It's still a little bit too early to say that, and this is a new virus to people anyway. And so we'll see if it behaves the same way as other respiratory viruses, as other coronaviruses do, and we have a dip in the summer. This is no coronavirus. It's the effect of 5G networks. I've only recently heard the 5G theory. It's fascinating. I'll say that. I can't give it any credence scientifically, but maybe I'm wrong on that. I wish I knew. How can we reopen a restaurant safely or at all for sit down? So, that's going to be one of the things that's going to be complicated for a little while to come. And I worked in restaurants all during my college life. And so I know what it's like to be in a restaurant, work in a restaurant, and then, living in a city where the entire industry is based on restaurants, New Orleans. So the restaurants are going to have to reopen very slowly. I would say, in the beginning, they're probably going to be able to take on maybe a quarter or maybe even half of the number of people they did before, which I really don't know how that's going to work financially for them, but they've got to find some way to maintain social distancing inside the restaurant. So they're either going to have to charge more money or, figure out kind of if it's worth it for them to stay in business longer and have fewer customers for a significant amount of time to come. We are not going to go back to any kind of crowded bars or crowded restaurants anytime soon. Cotton self-made masks don't protect you. You're correct. They don't protect you. The reason that we're talking about cotton self-made mask is to protect other people. And really a mask, even the medical grade mask, protects 2 of the 3 routes by which you get COVID-19. It does not protect the eyes. That's why when you see a healthcare worker, they're always going to have goggles or a visor on to protect their eyes as well, because we get the COVID-19 through your eyes just as easily as you get it through your nose and your mouth. If you work in the automotive industry and have to pull vehicles in and out of shop, what protective measures should you take? That's a good question. I hadn't really thought about that before, but if you can, I would say, clean down the vehicle inside when you're getting in, especially the high touch areas, the steering wheel and the shifter. And then, obviously any kind of windows or things like that you're going to touch. I'd basically clean down everything in the car. And, maybe it can be considered service for the customer, even though you may not want to do it. But I'd clean down everything for your own protection if you're going to be inside somebody else's car. How can beaches in Florida be open while this is still very bad? That's a very good question, and one that I really struggle to understand myself. It's definitely not going to help us in the fight. Are we going to have school back in August? I would predict that we will have school back. I think it's going to be set up somehow differently to allow us to maintain some social distancing inside the school, and maintain at least 6 feet away from the children, and the children really as difficult as it's going to be for them to learn to maintain social distancing themselves, and so I think that school's going to be back in August, I would guess, around that time, unless things get far worse, but I think it's just going to be under a different way of doing school. How long have I been doing this? I've been doing this for 20 years now. This is my 20th year of working in emerging diseases and outbreak response. How would they affect the kids' schooling when they will be able to go back to school? So I think I just answered that, but I just think that they'll be socially distanced, and they might even have it depends on where we are in the outbreak or the epidemic or pandemic at that time, but they might even have days where your kid comes on Monday, Wednesday, Friday, and Sunday, and other kids come on other days. So I'm not really quite sure how that's going to work, but we might have to get creative with it. Can you use isopropyl 70% to wipe all grocery containers, and can I also use it to wipe and disinfect my hands and the kitchen counters? Yes, you can. That's just fine. That's what we use in the laboratory to disinfect a lot of things. So you can use that. As expensive as it might get, you can use that. What will happen to those with jobs, rent, housing? Will there be more stimulus checks coming out? Honestly, I wish I knew the answer to that. I think the answer is absolutely going to have to be yes. The speed at which they're going to come out, I have no idea. But I completely get you on that. The government is going to have to provide some kind of stimulus check, and the ones that they have provided are not going to be enough to get us through this entire thing. Hello, you have thyroiditis. Are you at higher risk to getting the virus? You're not at higher risk to getting the virus, but you are at a higher risk of developing disease from the virus and getting sick from the virus. And so that's the only thing that I would caution, is that with thyroiditis, your immune system is going to be lowered, and you are at a higher risk from getting more severe disease. Do I think there will be a treatment for COVID-19 soon? Yes, I do, actually. I think, there's going to be a couple of things. I think remdesivir will probably be approved, and then they'll need to make more of it. There's going to be some time that they'll need to make sufficient quantities of that drug, because it's not a widely used drug. And then I think convalescent serum, so that's serum or plasma from somebody that survived COVID-19, and that you're then taking their plasma and putting that into someone that's currently infected with COVID-19, and that's going to help them get over COVID-19 by giving them the antibodies that you already have in your blood. So I think there's going to be at least 2 that are coming out very soon, and then hopefully a couple of others soon thereafter. I think the vaccine is probably a year to 18 or 19 months away, and that's being pretty optimistic with the vaccine. Vaccines take a very long time, and there are steps that you just simply can't bypass with the vaccine. You lost taste and smell only for 2 weeks. Yes, I had a friend in a similar situation, but that is something that I would seriously at least have the antibody test for COVID-19 after that, because that would be a signature COVID-19 infection without any other symptoms if you had the loss of taste and smell but no other symptoms. So, since the coronavirus shutdown began, nearly 17 million Americans have lost their jobs. That's 1/10 of the nation's workforce. It's a public health disaster. If the shutdown drags on, as many public health experts recommend it should, it's almost certain to kill more Americans than the virus. I completely get what you mean there, and that's why I honestly make always the recommendations I do with caveats. We can reopen America now. We're not going to be able to do it safely. And realistically, to get diagnostics up and running for everywhere in the United States, for everyone that needs to be tested, and for it to be both kind of tests, the test that tells you if you have COVID-19 and the test that tells you if you had COVID-19, it's going to take us anywhere from 2 to 6 months, and that's not currently in the budget to pay for that, even out of the trillions of dollars that was already approved, and so that'd have to go back before Congress. So what we're going to have to do are really put some thought into how we open each and every business, everything from grocery stores to auto washes to dry cleaners to restaurants to bars. How are we going to open them? How are we going to open them safely enough to where we keep some minimal distance between people, as much as we can? And it's going to be experimental. Some of it's going to work and some of it's not. And we may have to actually go back on some of that, just like they have in China, because they tried to open everything up pretty quickly in China, and they ended up reversing course because they noticed a lot of infections were coming back to China. I am not providing medical advice. I'm sorry if you thought I was in any case. I did not mean to indicate that I am providing any kind of medical advice. I'm talking about medical drugs and medical trials of the drugs. So that's the only thing I'm qualified to speak about. I am not a medical doctor. You are correct. What should you use to wipe down groceries? You can really use anything, even down to soap and water, to wipe down. It depends on what you're talking about. If you're talking about just kind of plastics and things like that, you can use kind of household disinfectants if you want to. Just regular soap and water, or just even a wet wipe would work fine to wipe down groceries. Fruits and vegetables, wash them how you normally would, or you can mix some vinegar and water. And if it has a peel, of course, you have to be less concerned about it. If it's something you're going to peel, I should say. I have to wrap this up in about 2 minutes, but I apologize. So once you have it and you recover, can you get it again, and can you be contagious again? Right now, I'm going to say the answer is probably. In the laboratory and in rhesus macaque and monkey studies, which is what we base most human data on, you cannot reinfect those monkeys. They were infected, they recovered, and they tried to reinfect them again with COVID-19, and they weren't able to do so. Their bodies fought it off. And so we take that to mean that that's probably the case in humans as well, and that is the case with a lot of viruses a lot of viruses in humans. Once we get them and recover from them, we'll have some kind of temporary immunity to them. That being said, there's around 91 cases from Korea that either had false negatives or they were reinfected again, and we're not quite sure which that is. This is a new virus, so it might be the chance that not everyone. There might be a chance that not everyone is immune to it and can get let me say it this way. There might be a chance that a certain percentage of people can get reinfected. It's just too early to say at this moment. Sorry, I don't have more information on that at the moment, but that's a hot topic of debate right now. So with that being said, I have to wrap things up today at half an hour. I hope this is helpful. And on behalf of NBC News, thank you for tuning in for our Facebook Live, and we look forward to talking with you again soon.